Enough. My name is Dr. Arthur Lorimier. I am a chief of pediatric gastroenterology at the University of California at Davis. I am a clinical professor and I care for trans-identified children. My comments are strictly my own opinion as a pediatrician and a California native and are not intended to represent the position of the University of California. A transgender child is a child with a gender identity disorder or gender dysphoria. Under the current Diagnostic and Statistical Manual of Mental Disorders, the dysphoria is characterized by a child's severe and persistent discomfort with his or her sex. Until about a decade ago, gender dysphoria afflicted fewer than 0.01% of the population and mostly young males. That figure began increasing exponentially right around the time schools started teaching that a person can be born in the wrong body. Social media contributed to this massive surge in adolescents, mostly females, into adopting trans identities. Last year, Reuters reported that in 2016, there were 1,000 California kids diagnosed as gender dysphoric. By 2020, that number had tripled, and that increase continues to steadily climb. Nothing in medicine increases like that without external forces. The CAS review published last month is the largest systematic review in the world regarding gender dysphoric youth. The report raises significant concerns about socially transitioning minors using new names or pronouns or whatever, stating that the transition is not a neutral act but a profound psychological intervention with potentially irreversible consequences. The CAS review also noted that dysphoria is often combined with other acute mental health issues that must be addressed. Dr. Cass found the quality of the evidence to transition minors was, quote, disappointingly poor. New court documents reveal that the Johns Hopkins 2020 review reached the same conclusion. Parents must be involved in their gender dysphoric children at the inception of the adoption of a new identity. Schools should not conduct psychological interventions without parental consent. Parents play the most vital role in the physical and mental wellness of their children. Gender dysphoric youth are at greater risk of suicide than their peers from the distress of the dysphoria, not from being unaffirmed.